So this is going to be a long one. The first cancer that we are going to talk about is papillary cancer of thyroid. This is the most commonest yet the most widespread cancer which is present in the thyroid cancer and accounts for approximately 80 to 90% of all thyroid cancer patients. It has got the best prognosis and spreads in a very regular pattern only to the lymph glands in the neck mostly. Now this cancer can be easily treated and has got a 5-year survival which ranges from around 95 to 99%, with survival going up to 20 years in these kind of patients. Now the treatment usually takes place in the form of surgery along with radioiodine therapy, and there is also suppression of the thyroid hormones after that. The second one is follicular cancer of thyroid, which accounts for approximately 10 to 15% of the thyroid cancers. Although it is a good tumor, but it is more aggressive than the papillary one. It can go up to 10 to 15% of the cases and can spread to different organs like bones and lungs. This cancer has got a good prognosis also, and the treatment usually takes place by thyroid surgery, which entails removal of the thyroid gland along with radioiodine therapy. The next cancer on the list is medullary carcinoma of thyroid, which is an aggressive cancer with genetic predisposition. Now, this cancer is quite aggressive and can spread from the neck to the lymph glands and to other body parts quite rapidly. It is usually diagnosed with tests such as serum calcitonin and CEA. The genetic test which is actually done for this is to find out for MEN2A and 2B syndromes, which are basically multiple endocrine neoplasia syndromes. Now, if found positive for this particular genetic mutation, you should consider getting your thyroid removed as soon as possible, because it is very likely that you might start harboring a cancer in it and we might not be able to detect it until very late. Now, following this is the most dangerous of them all, that is anaplastic carcinoma of thyroid, which is extremely rare and can spread within days to weeks, creating a huge swelling in the neck which can start choking you. The treatment in these cancers is usually limited to surgery in case of medullary carcinoma of thyroid, whereas in anaplastic carcinoma of thyroid, treatment is usually palliative, but there is presence of immunotherapy, targeted therapy in the form of lenvatinib, and some radiotherapy to stop the spread of disease.